Okay, it looks like we've still got quite a few people coming in, but let's get started with the logistics. Welcome everyone to our first of 3 Leadership and Aging webinars. Just going over some webinar logistics with everyone. You're able to join by smartphone, tablet, or computer. We have a number if you need to join by telephone. On the screen, you'll see there's the meeting ID, password. We have the live captioning streamed throughout the webinar, and we also have ASL interpretation via webinar as well. We do have the ASL interpreter pinned, but if you need to also pin it yourself, please feel free to do so. The recording, slides, and transcripts will also be posted on CDA's Hubs and Spokes Network for Aging and Disability webpage that can be found directly on our homepage. There's a link. Next slide. So we'll have some time for questions and comments. The final 15 minutes of the webinar is reserved for questions and comments. Attendees joining by webinar, if you're using Zoom, you may use the Q&A function to ask your questions, or you can simply click the raise your hand button to join the line. Our moderators will announce your name or the last 4 digits of your phone number that you're calling in from, and will ask you to unmute your line during that time. Attendees joining by phone, you may press #9 on your dial pad to raise your hand. The moderator will announce the last 4 digits of your phone number and will unmute your line. If you need additional information or any feedback regarding this webinar, please feel free to email engage@aging.ca.gov. Now I'll turn it over to Mark Beckley.
Great, good morning, everybody. Thank you so much for attending the first of 3 informational webinars on leadership and aging. These webinars will be hosted by a series of experts in the field of academic research that will present on different research and findings that may inform our Hubs and Spokes initiative. Today, we'll be hearing from Dr. Kate Wilbur and her research assistant, Haley Gallo, who will be presenting on what factors should be considered in terms of determining what makes a AAA a strong hub for a network. Equally as important, what factors should not be considered in terms of considering AAA's strong hubs for networks. On Wednesday, October 22nd, we will be hearing from Dr. Amanda Brewster, who's a doctor with an assistant professor of health policy and management at UC Berkeley, who will be presenting on improved AAA performance via partnerships with health plans. Also coming soon are promising practices in performance criteria and excellence. This will be presented by leadership from US Aging, which was formerly known as N4A. So we look forward to learning together from our experts. And let me now introduce Dr. Wilbur and soon to be Dr. Gallo, currently doctoral candidate Haley Gallo. So Dr. Wilbur is a professor at UC Leonard Davis School of Gerontology, and she teaches courses on administration, public policy, and long-term care. Dr. Wilbur also serves as the co-director of the Secure Old Age Lab at USC, the National Center on Elder Abuse, and the USC Family Caregiving Support Center. Dr. Wilbur's research is focused on elder economic security, protecting vulnerable elders, and improving health and long-term services and supports throughout our aging network. We're happy to have her here today. In addition, Haley Gallo is a doctoral candidate with the USC Leonard Davis School of Gerontology, and is a research in Dr. Wilbur's Secure Old Age Lab. Haley's research focuses on policies that promote the goals of the Age-Friendly Cities and Communities Initiative. Thank you both for being here with us today, and with no further ado, let me hand it to Haley Gallo.
Thanks so much for having us. I'm excited to be here today. And I apologize that my video is off. I live in a rural area and have some internet connectivity issues. But my name is Haley Gallo, and I'm a doctoral candidate at USC. And today I'll be presenting on different ways to measure success of the aging network. Next slide, please. I'm sure this won't be news to anyone participating in the webinar today, but the older adult population is growing both in number and proportion. And this growth of older adults is outpacing Older Americans Act funding. The image on the right shows that the projected population of older adults in the United States is growing much faster than the Older Americans Act funding, especially after accounting for inflation over the past 2 decades. Next slide. But in spite of their growing demands and limited funding, AAAs have proved for decades that they can be innovative and adaptable, helping older adults maintain independence in their homes and communities. And AAAs had to be even more innovative and resourceful during the COVID-19 pandemic. There have been several reports that have come out over the past year and a half showing how AAAs acted quickly to respond to the pandemic. US Aging, formerly known as N4A, published reports that showed all of the steps that AAAs took to meet the increasing needs during the pandemic, including innovative examples from the field, such as partnerships with local restaurants, for example. And Dr. Wilbur and I published a paper discussing the transformation of AAAs during the pandemic. And Dr. Brewster, who will present at the next webinar, Dr. Brewster and her colleagues said, if you want to know how to support older adults during the pandemic, just look to the AAAs. Next slide, please. I've heard time and time again, if you've seen one AAA, you've seen one AAA. There are 622 AAAs in the United States, and they take on a range of structures and offer a variety of services. Next slide. AAAs range from being run by nonprofits to councils of governments and county governments and other structures. Next, please. They offer an average of 27 services that help older adults and people with disabilities continue to live at home for as long as possible. These range from transportation services to home modifications to various evidence-based programs. And as Dr. Wilbur and I have been studying AAAs, we've noticed stakeholders paying increasing attention to how AAAs are structured. So are they run by nonprofits or counties? Are they in an integrated agency with other departments that serve older adults? But we've also noticed a desire to move away from simply compliance-driven metrics. We know that AAAs send a lot of reports and data to their state units on aging, but how can we move from just checking the box and reporting the number of meals served, for example, to focus more on client outcomes and innovations? And this shift is especially challenging given the diversity of how AAAs are structured. And if they're already understaffed and underfunded, how can we develop a set of metrics that allow them to showcase their successes without creating a burdensome reporting process? Next slide, please. So the research that I'll present today builds on previous work. It started with the feasibility study in which we examined whether Los Angeles should consolidate its 2 AAAs. And Dr. Wilbur will focus on this in the second part of the presentation. We visited 5 AAAs in California to learn how they were structured and integrated with other county departments. And I worked with Lily Estenson and Shelby Brown at USC to read all 33 area plans from California AAAs. And we developed a data set that allowed us to study links between AAA structure, funding, and service delivery. But now we're using what we learned from these studies that focused on Los Angeles and California to now examine AAAs nationwide and study how we could measure their success. Next slide. The purpose of this study is to examine whether and how the Aging Network should measure success of area agencies on aging. We want to include experts to inform reasonable, equitable, and measurable indicators of success, and also to identify which factors should not be used to measure success. And as states and the federal government become more interested in measuring client outcomes and demonstrating the value of AAAs, I wanted to gain input from AAAs themselves about what metrics they think should be used, rather than relying on top-down approaches and standards. Next slide. So to do this, I'm using a technique called the Delphi method, which allows us to include subject matter experts to build consensus, and it relies on multiple rounds. So in the first round, experts express their opinions by completing a survey, and this is the part that I'll present today. And next, opinions are summarized and grouped into a new question list, which will be sent out in a second round of surveys. And this gives people the opportunity to reassess their responses based on a summary of what their peers said. And then finally, a small group will finalize a list of recommendations. And the confidential nature of a Delphi study helps to prevent groupthink and encourages people to speak their minds without being judged by their peers. So in the first round of the Delphi study, we had 67 people throughout the United States participate with a range of backgrounds. They represented different regions, structures, roles, and states. More than a third were AAA employees, and we also had service providers, researchers, national organization employees, state units on aging, and federal employees participate. Next slide. Almost 30% of the participants were from California, but we also had participants from across the country. In this map, the turquoise colored states had one person from that state complete the survey. The brown states had 2 people participate, and the magenta states had 3 people participate. Participants were asked to indicate all of the types of regions that they were familiar with, and about 3/4 said they were familiar with urban, suburban, and rural AAAs, and about 1/4 were familiar with remote or frontier AAAs. About half were familiar with nonprofit or county-run AAAs, 1/3 were familiar with city-run AAAs, and almost 1/4 were familiar with councils of governments or joint planning association AAAs. And after reviewing the literature and consulting with 3 diverse AAAs in California, I developed this list of potential factors that could be included in measuring AAA success. And the screenshot that you see on this slide is a broken down version of this. So in the first round of the survey, participants were asked follow-up questions about all of the factors they either strongly agreed with or somewhat agreed with. And they were also given the opportunity to suggest additional ways to measure success. And these will be added to the second round of surveys. So the first topic that participants were asked about was related to compliance. And all of the topics that you see on the left in this blue part of the slide, those are all of the topics that people were asked about, and that's what we'll go through for the rest of this presentation. So next slide, please. 100% of respondents agreed that compliance should be used to help measure AAA success. Next slide. So if more than 50, can you go back one slide? Thank you. So if more than 50% thought that a topic should be included to help measure success, the second round of surveys will ask follow-up questions about that topic. And otherwise, that question will just be excluded from the second round of surveys. So for all of the people who said that compliance should be used as an indicator of success, they were then asked how to measure compliance. And about 2/3 said we should look at whether AAAs abide by regulations set by the state and the Older Americans Act, or that we should look at achieving community needs assessments that AAAs list in their area plans. And almost 1/3 identified another way to measure compliance. So for example, people recommended looking at financial audits, measuring compliance of subcontractors and service providers, earning national accreditation, or abiding by guidelines that the AAA sets for itself. Someone also indicated that we should look at qualitative measures for community needs assessments. And the next slide shows a video. If possible, can you play it, Nancy? And otherwise, I can just describe what happens here. So in the next round of surveys, participants will see the results from the first round. So they see the bar graph that I just presented. And then these topics on the left are all of the things that their peers suggested as ways to measure compliance. And people can drag them and drop them to indicate, is that a good way to measure compliance? That's not really a good way to measure compliance, or I'm not sure. And this will happen for all of the additional topics that we'll go through for the rest of this presentation. Next slide, please. Next slide, please. Thank you. So because AAAs are expected to do a lot with limited funding and staff, I asked participants about whether resource management should be used as an indicator of success. And 94% said, yes, resource management should be used. And then participants were asked follow-up questions about how to measure resource management. About 3/4 indicated that cost efficiency should be used to measure resource management. And about 2/3 said that a AAA's ability to draw in outside resources should be used. 64% said the number of services a AAA provides should be used. And 41% listed another way to measure resource management. And less than half said that we should look at the amount of unused funds that are returned to the funding source. So that will not be included in the next round of surveys. And for each of the topics that a participant said should be used to measure resource management, they were then asked follow-up questions about how to measure that topic. So for example, they were asked about how to measure cost efficiency by selecting all of the topics they agreed with from a list. But for the sake of time, I won't show those responses. But in the next round of surveys, participants will be asked whether they agree or disagree with their anonymous peers' ideas. And there are many programs that AAAs offer that have been shown to positively impact clients. For example, AAAs can reduce falls and help clients manage chronic diseases. So I asked participants about whether these evidence-based and evidence-informed programs could be indicators of success. And 81% either strongly agreed or somewhat agreed that evidence-based programs should help measure success. And the most common suggestion for how to measure this was to examine client completion rates for the evidence-based programs that a AAA does provide. But participants also thought that we should examine the number of evidence-based programs and evidence-informed programs that a AAA provides. Ultimately, the goal of a AAA is to improve independence and quality of life for older adults and people with disabilities. So next, participants were asked whether client outcomes should be used to help measure AAA success. And 97% agreed. Next slide. And I left the follow-up question about client outcomes open-ended. I've been told by many people, including folks at CDA and US Aging, that AAAs are quote unquote surveyed to death. But interestingly, when I asked what's a good way to measure X, Y, or Z, often the most common answer was, oh, you should send out surveys. And maybe that's just because the people who participated in this study were willing to take this survey, but I thought that was an interesting observation. But people also recommended that we measure client outcomes based on other topics listed here, including fewer medical encounters, improved health, food security, mental health, and economic security. And some suggested assessing outcomes by linking to other databases and by looking at client mortality rates. The age eligibility for most Older Americans Act programs is set at 60 years. And while some AAAs serve a large proportion of older adults in their community, others serve a smaller group that may have greater needs. So I asked participants whether the proportion of the local population aged 60 and older that they serve should be used as an indicator of success, and 83% said yes. And in addition to looking at simply the number of clients served divided by the estimated number of older adults in the region, people also suggested looking at the proportion of clients served that had the highest need, and to compare characteristics of clients served compared to the population. Some also indicated that they needed help to do this, either from academic partners, the state, the Administration for Community Living, and some requested a statewide data collection system that could help them do this. Although Older Americans Act programs are not means-tested, AAAs are expected to prioritize clients that have the greatest social and economic needs. So I asked whether equity measurements should be used as indicators of success. And 93% said yes. About 80% of participants agreed that social and economic need should be used to help measure equity. And then they were asked follow-up questions about how to measure economic need and how to measure social need. but about 47% also suggested additional ways to measure equity. Now, by design, AAAs are expected to link clients to services in the community. And increasingly, AAAs are also attempting to break down silos and link otherwise disparate programs and departments within their communities. So next, I asked participants about a AAA's role in community linking, and 94% said that a AAA's ability to be a community linker should help measure their success. For example, many said that we should look at the number of partnerships a AAA forms, how AAAs make referrals, and other topics. AAAs often describe themselves as a community's best kept secret, and often clients attribute services to the senior centers or the providers who contract with the AAA rather than to the AAA itself. And so I asked people whether the visibility of a AAA was important. And 86% said that visibility should be used as one of the indicators of success. And participants had a range of ideas about how to do this, like using surveys, but they also said you should conduct random phone calls, count the number of events that a AAA attends, and people suggested not only looking at whether people know about the AAA, but also about how it's perceived in the community. But knowing about AAA services doesn't really matter if it's not accessible, either because services aren't offered in multiple languages, or events aren't physically accessible, or because the wait lists are too long. So next participants were asked about accessibility. And 82% said that accessibility should be used to help measure AAA success. They said it was important to examine the physical accessibility of the AAA building and the neighborhood surrounding it. And they also said it was important to measure how participants can access services and get in touch with the AAA, and whether services are offered in multiple languages, and whether they were accessible to people with visual and auditory impairments. Now, after talking to a lot of innovative and passionate AAA directors in California and also in other states, I began to wonder how important the role of a leader is in determining the success of a AAA. So 91% said that leadership should be used to help measure AAA success. And respondents had a range of ideas about how to measure leadership, including by surveying staff and stakeholders and looking at staff retention. Some said that the state or the ACL or Administration on Aging should set standards and requirements for leaders, or that we should examine how many awards the AAA receives. And others mentioned things related to how the AAA is a leader in its community, like how many committees it's involved in, whether the AAA leader is consulted by others in the community, and whether they are innovative and adaptable. Participants were also given the opportunity to recommend other factors that should be used to help measure success. Next slide. And some of the topics that came up were a AAA's adaptability and how much it fills gaps in the community rather than just compete with existing programs. And people also mentioned client satisfaction, inclusivity, innovation, and responsiveness to the most vulnerable groups. So now that we have an idea about how to potentially measure success, I wanted to know what should happen if a AAA is successful on an indicator. And some said the AAA should be rewarded with funding or given an award. Some said that the Administration on Aging should recognize it as a best practice and share that information with others. Some said that states should publish scorecards. And one person said nothing should happen because AAAs are just expected to be successful. But on the flip side, I asked what should happen if a AAA is not successful on an indicator. Participants said that the state and the Administration on Aging should work to help the AAA improve or determine whether that indicator is even appropriate for this AAA. People suggested considering staff changes, peer support, and again, a statewide dashboard. While some recommended pay for performance, many made it very clear that AAAs should not have their funding cut because this would only make matters worse and make it more difficult for the AAA to improve. And just to get a general sense, I asked, how important is it to measure success? And about 90% said it was either very important or important. Again, we keep hearing how unique AAAs are. So I asked whether AAAs with different characteristics should be held to different standards. This was an open-ended question, and I noticed a few themes, including people saying, yes, AAAs have different resources and needs, so you can't use a one-size-fits-all approach, or yes, but you can compare AAAs to peer groups, or some people said you should set a baseline standard, but then allow for flexibility. And others said no, because people should be able to expect to receive similar programs regardless of where they live, or that AAAs all have the same opportunities and it's what they make of them that counts. So in the next round of surveys, participants can indicate whether they agree or disagree with those statements on that last slide. And as I was developing the survey, someone from a state unit on aging recommended that I ask whether respondents needed any additional support. And this person recommended that I clarify other than funding, but I intentionally left that part out of the question. And unsurprisingly, the most common thing people said was that they needed more funding. But people also indicated that they would like more technical assistance, more recognition of aging services in their local community, more flexibility like what they were afforded during the pandemic, and less emphasis on administrative tasks. And this theme of administrative burden came up at multiple points in the survey. So for example, when I asked if there was currently anything that they were required to report that should be updated, several indicated that they had too many administrative tasks or there was too much emphasis on what they called widget counting. And I know that some of the reporting requirements cannot be changed, but in the next round of surveys, I gave people the opportunity to identify specific administrative tasks that they think should be updated and how they could be updated. So even if states or ACL aren't able to change or reduce these administrative tasks, I think it's important to make them known. So for next steps, the second round of the survey should be in the field any day now. And this one will have fewer free response questions and more multiple choice options. So it should be shorter. And the goal is to achieve consensus about how to measure AAA successes and outcomes. I'll develop a list of recommendations about ways to measure AAA successes and topics that should be avoided. I'll disseminate the findings to AAAs, states, and the Administration on Aging. And the goal is to use this bottom-up approach so that AAAs can say, this is how we want to be assessed, this is how we want to demonstrate our innovations, and these are the areas where we need some help. So if you'd like to participate in the next round of the survey, or if you know someone who works at a AAA, a state unit on aging, or as a service provider, feel free to contact me. And like the first survey, your name will not be linked to your responses, and everything will be confidential. So thank you so much. I'll pass it over to Kate now, and I look forward to talking about questions.
Thank you, Haley. First of all, let me just say how proud and excited I am about this research, about participating in the innovations that are happening in California, and about the opportunities to move ahead with what I've spent a lot of my career talking about, which is we are an aging society. We have AAAs, which are the backbone of the service delivery system, and very innovative and unique in that they attend to local communities' unique, diverse needs, but they also have standards at the federal and state level. So I think this is a unique opportunity. I also want to congratulate Haley and just say how pleased I am to have a team led by Haley who actually loves reading area plans and the literature in this area and is really, really excited about doing this work. Kind of a hard act to follow, Haley, but I want to pivot a little bit to work that was kind of a background for the work that Haley's doing now. And that is that we were asked by the County of Los Angeles to look at how they structure services in Los Angeles for older adults. And I'll explain a little bit about kind of what that looks like now. But the question that the Board of Supervisors asked us is here, is what's the feasibility of creating a standalone county department for older adult services? And I think a lot of what Haley talked about is sort of the underpinning of this work as well. So next slide, please. So here's our rendition of, and this is something I've been talking about for a lot of my career, is that aging services are fragmented. It's very hard to organize them and for services for older adults and adults with disability. With Los Angeles, they're fragmented from the get-go, and that Los Angeles has 2 area agencies on aging. Now, the 2 area agencies on aging work very collaboratively together, but they're still one's in the mayor's office and one's in the County of Los Angeles. And just a bit of context, Los Angeles has a diverse population of about 10 million people, over 1 million of whom are older adults. It's sort of close to the size of Connecticut in terms of geographic. And one of the things that we like to say is the population of Los Angeles is actually bigger than 41 states. There are a variety of innovative programs and services, and many of them are at the county level. So the question was, what should a new department look like if in fact a new department was what's needed, and what should be in it in terms of aging and long-term services and supports. And then another background but critically important question is, how would this consolidated agency interface with all the variety of other city and county and private entities that serve older adults? And this is, I'm sure, what many of you grapple with as well. And how does this department continue to provide and enhance its ability to provide leadership on aging issues for the County of Los Angeles? And I just want to say one other thing is, I'm very excited to be doing this work in California at this time with great leadership and really wonderful innovations and a master plan for aging, and just see all these things getting traction. So I think the time is now. That was a quote from an old study 20 years ago. The time is now, and nothing, I mean, not nothing, but there was work to build on it, but the time really is now, and we're seeing a lot of innovation. So next slide. So the Los Angeles County Board of Supervisors had a motion in early 2019, which said that they wanted a consultant to look closely at marshaling all the services and resources available to older adults into one agency. And I think the operational word is marshaling. What does that mean? But then more specifically, they wanted us to look at the feasibility of creating a standalone county Department of Aging. And the current department is kind of embedded in another agency. Determine what goes in and what would be consolidated, and then what wouldn't, and I'll speak to that in a moment. Engage the city of Los Angeles to determine what parts of the city should be included. And I talked about the complexity of the County of Los Angeles, but the county includes 88 cities. One of them is the city of Los Angeles, which is one of the largest cities in the country. And then there are several other very large cities, as well as some smaller cities. LA County also, many of you will know this, but some of you won't, is diverse in that it has some large areas of rural populations, as well as highly concentrated urban populations. And then an important part was to solicit community stakeholders and get their input. And there was a good foundation for this in that the county and the city of Los Angeles had come together to create Purposeful Aging Los Angeles, more than 5 years ago. Purposeful Aging Los Angeles is the age-friendly initiative in Los Angeles. So there was a very good foundation of stakeholders at the table and very good foundation for mechanisms for them to provide input. And I will also say that Haley and I had the opportunity to study co-production, co-design, stakeholder input. How do you get key people at the table prior to this? And that the state of California has done a fabulous job at getting key stakeholders actively involved and at the table and looking at how their various ideas for how to improve this. So Haley has the Delphi and including people, and then there's also this foundation of stakeholder engagement in the County of Los Angeles, in other counties, and in the state of California. Next slide, please. So we set some priority goals for what a consolidated agency should include, and these somewhat mirror some of the priorities that Haley presented in the results for Delphi. But one of the most important ones we heard over and over was visibility. Can people actually find the department if they want to find out what services are available, how to link to services, what information is there? And this is always a challenge, but we think it's a challenge that's being better achieved in many areas, but how do we encourage this and keep working on it? How do we develop services that are seamless? And of course they won't be seamless because you can't consolidate everything that serves older adults into a huge mega agency. But how do they feel seamless to the older adults so they don't have to know that this program came from here and this information came from here? How do you consolidate information? And how do you best coordinate across programs? Haley talked about cost effectiveness, and I think that goes without saying that that's always a goal. But I think you'll hear from the speaker next week and from some other things that we've worked on, that AAAS and aging services can do a lot, and maybe this doesn't get measured, but how do you prevent older adults who are at risk of becoming unhoused and evicted? And there's been some really good programs coming out of the AAAS and out of the state to do that. You'll see that nutrition services actually reduce hospitalization costs. So I think there's some unsung heroes among many of the aging network providers and structure that are cost effective already. And I think we need to better figure out how we identify those and get those out into the sort of broader decision-making information. So LA is 10 million people, huge geographically. And so we looked at community-centered local neighborhoods. We also, as Haley indicated, we went to some exemplar counties around the state. San Francisco has an excellent hub model where they have centralized services, but out into community hubs. The County of Los Angeles and the city have very good multipurpose and community services. How do you build on those? Equitable across the range of users. And Haley talked about those in greatest social and economic need, but also the universality of Older Americans Act services and making sure that somebody who needs a yoga class can find out through the Older Americans Act Aging Network, as well as somebody who needs more long-term services and supports. And we talked a bit about how to make it consumer driven and co-designed, and that is very much in the culture of the County and City of Los Angeles and in the California Department of Aging, and kind of, I think, across the board in the state. Strong data management. So this is a challenge that has been worked on for a long time. And of course, it's a moving target. And then you've got some constraints on it, but how do AAAs help manage data in terms of information, but in terms of client tracking and costs and measuring some of the things that we talked about? So we also found some exemplars of this being done at the county level that can be built on, and dashboards and the work that's going on at the state. Again, this helps with visibility and it helps with measurement. And there's a lot of important activity going on in here on this area that we need to build on. Public-private partnerships. There are, of course, in Los Angeles, in the state of California, and communities across the country, a lot of really great work going on in the private sector. How do we partner with them? How do we engage with them? And there's a lot of potential for more resources being tapped that way. So that's also an important priority goal that we wanted to put in front of the Board of Supervisors to say, you should build out with these activities. The capacity to innovate. Haley talked about evidence-based practices. There's great research in this area. There's also evidence-informed practices and building the evidence, partnering with universities and colleges and other researchers. And so that's an important component. And we've worked collaboratively with the City and County of Los Angeles to do that, with the state. And I think more of those partnerships are important. Build capacity across sectors. So what goes in? What do we tell the County of Los Angeles? What goes into the core frame of services? And how do you help work with for example, prosecutors of elder abuse? LA County has a distinct office, but they're not going to go into the AAA. How do you build their capacity? How do you build the capacity of the mental health services and public health and other entities that serve universally all ages? How do you build as a AAA and a leader in aging, the capacity of all those other departments to better serve the older adults that are part of their service population? And so that was an ongoing theme. One of the things we heard from stakeholders is the Older Americans Act programs are great and innovative and broad, but also the importance of bringing in art and culture and ways to engage the community. And this was particularly true in LA's purposeful aging, to get people to the table for things that really help enhance the community. And then recognize that older adults are extremely diverse. They have diverse needs, interests, and the opportunities to contribute. And in Los Angeles, it was called Purposeful Aging LA, to note that it is the arrows go in both directions. Older adults are a huge, somewhat tapped, but still untapped resource that can bring incredible enhancements to our communities. So those were the kinds of things we wanted to use to frame our report to the County of Los Angeles. So here's what we recommended. We recommended that there be a phased in building of a core structure of consolidated aging services that would start by bringing in the two area agencies on aging to a single department. We didn't specify if that would be a joint powers or if that would be how that would be. I think that's up to the local leaders. But we said it should start with the Older Americans Act legacy programs, the nutrition, the multipurpose centers that are there, the variety of programs that come down through the Older Americans Act. And then it should build other services, especially in long-term services and supports. So Adult Protective Services serves older adults and adults with disabilities. That's currently sitting in the County of Los Angeles. It is consolidated. Some of the other counties that we went and did site visits at have Adult Protective Services integrated into that single department, aging department structure. We recommend that that stay. Those of you in California know that California has a very large in-home supportive services personal care program. Some counties have that included in the Department of Aging and Disability. Others don't. We recommended that the County of LA phased that in. And we also recommended, after this was all put together, the next stage would be the Office of Public Guardian that serves older adults and adults with a need for, often because of mental disorder, for a co-conservator in LA, in California. And then we recommended decentralizing to local hubs. We recommended using some of the things that were going really well in the city of Los Angeles, some in the county. I'll just say parenthetically, we suggested a pay-for-performance model was not good for a variety of reasons. And then looking at the exemplar communities and effective integrated data system to help with pulling together the core services, but also help with client tracking and utilization and costs. And there are models of how to do that as well. So extremely complicated, but the County of LA and the Board of Supervisors passed a motion to begin carrying this out, and they're starting down the path. And that's really exciting to see that's underway. So tune in again to see what's going on with this extremely exciting, extremely challenging restructuring. So, and I'm hopeful that the puzzle pieces will fit together and that this integrated, consolidated department will be able to do well with those priority goals that we suggested. And now we want to be sure that you all have lots of opportunities for questions, and we'll attempt to answer your questions. So thank you all so much. And thank you for this opportunity to talk about work that we're really excited about.
Thank you so much, Dr. Wilbur and Haley, for your fantastic presentations. We are going to go ahead and go into question and answer time. If folks want to go ahead and post a question in the Q&A, we can share those with Haley and Dr. Wilbur. So far, I see one question. And it's that with so many different AAAs being governed at the county level, how can Haley's research, the surveys, really be used to help benefit those smaller and more independent AAAs?
Yeah, certainly. So the goal of this work is not to say, here's the best structure of a AAA. All AAAs should look like this. In fact, it's just the opposite. AAAs are intended to be diverse so that they can serve very diverse regions and people. And so with that in mind, the goal of this is to identify how to measure success for AAAs that are very different. And the goal is also to point out and to showcase that that could mean that there is no one size fits all standard that fits all AAAs. But there are certainly promising practices that we can build on, and that was one of the goals of this study as well.
Can I add my 2 cents too? I think one of the great beauties and innovation of the AG network is that you have standards, and you'll be working on, what are the metrics and the measurements and what is success. That's always a challenge, but you have standards. But this AG network also offers the opportunity to be very responsive to local community needs. And I think that model is really optimal because you balance what goes on in a local community and then what are the expectations with ACL and then down through the state units to the AAAs.
Great, thank you. Let's see, for Haley, we have another question. It's if all 10 metrics receive large majority of support, do you intend to reduce or prioritize your final list of recommended metrics?
That's a great question. And it is the reason that the second round of surveys I'm still waiting to put it into the field. So yeah, the goal is to come up with a manageable list of recommendations. And currently, because all 10 were popular, that it might dilute the efforts. But currently in the survey, I'm going back and forth about whether I want to ask people who take the survey to rank things. The problem is I'm worried that will lead to a lot of survey dropout because it would make the survey take longer to complete. So what I'm currently deciding is whether I want to ask people to take more time and to rank things within the survey, or if I want that to happen in the final round of the surveys where I invite people to come together and develop that final list of recommendations. And in the second round of surveys, people have the opportunity to share their email address if they would like to be included in that final group of experts who make the final list of recommendations.
Thank you. And of course, I see a question about whether we will be posting this recording, and we will, and I'm going to post the link to where we're posting the recording and the slides in the chat in a second. Any more questions? Here. Oh. So a question from Carlos Londono. This one is about Los Angeles. So in the project of creating or consolidating that Los Angeles Department of Aging, is the Department of Public Health in the picture as an additional strategy to integrate those services such as data tracking and healthy aging programs and other sorts of programs?
That's a great question. And so there are a number of core programs. Public health is hugely important for older adults. And so if you think about the core services I mentioned, and then in the next sort of ring out, bring to the table public health, housing, mental health, a variety of other critically important services. And I believe what the county is doing is they have a task force that's comprised of a number of key stakeholder representatives of key stakeholder departments. And that is the exciting part about the universality of aging. But that because older adults are one sort of strata, that they're served by a lot of generic departments that serve others. And so again, I don't want to get up on a soapbox here about how important public health is to be at the table, but I think they're critically important. And I think that's part of the county leadership is to bring those critically important departments to the table. And I know that both the city and the county of Los Angeles have been attempting that, but I think this consolidation effort will increase that. And I'd be happy to talk to anyone later if you want to email me about the specifics.
Great. Another question for Dr. Wilbur. In your research, did you come across any research or best practices regarding regional collaborations? That's from Victoria Jung.
So I'm going to ask Haley to answer this in a minute. I guess I can't identify formal regional collaboration. I think there's quite a bit of informal collaboration. So when we went to the 5 exemplar counties, they all knew what each other was doing. I think they are brought together regularly by the Department of Aging. And I guess it would depend on what you mean also by regional. So there's also a lot of AAAs that are joint powers. So in California, historically, we have AAAs, everything from 2 in Los Angeles to, Mark can correct me, but I think there's 8 in a sort of regional AAA consolidate entity in the Northern California. So I don't know if I answered the question, but that's my 2 cents. But Haley, did you find any research per se?
No, I think my understanding is the same as yours, Kate. I don't recall any formal collaborations regionally, but they're more informal. All of the AAA directors know each other and, you know, share tidbits and tips. But if you have any suggestions about where we should look to find those formal collaborations, I welcome those.
And just let me add one other thing. So we've got California Department of Aging bringing together AAAs, and also the C4A, which is California's Area Agency on Aging network, and they have an annual conference, and they share best practices and they network. So I think there are a lot of mechanisms for them to interact, but somebody from a AAA would have a better sense than I do about how that actually works.
And we have a quick follow-up question to that. What were the exemplar counties used in your study?
Okay, so we looked at San Francisco. Let me just say, we did a study in 2007 that looked at some of these counties, and we went back to them. So San Francisco was one, and San Diego was one. And then we looked at Riverside because they are doing really good things, and they had a very different structure from the consolidated structure in San Diego and in San Francisco. We were just about ready to go to San Mateo, and COVID hit, and that changed things there. And then we did similar site visits with the city and the county of Los Angeles AAAs.
Okay, great. Another question for Haley. Could you clarify how you actually found the 67 participants in your study? Were they sourced randomly or through an aging services network?
Sure. So I actually used a few different sampling strategies. One of them was that I looked at a list of every single zip code for every single state. And then I selected the first 2 zip codes in each state and the last 2 zip codes in each state. I put those zip codes into Elder Care Locator and then emailed every single person whose contact information was listed in Elder Care Locator for that locality. So in addition to that, I also reached out to CDA, and CDA shared the survey with the California AAAs. I reached out to the National Association for Area Agencies on Aging, and then other researchers who have published about the aging network. So I used a couple of different sampling strategies.
Wonderful. Thank you. We now have 1 minute left, so I want to go ahead and thank our speakers for joining us today. Your research is invaluable and a great service to our field. And I also want to put a plug in again for next week's webinar, September 22nd. Apologies, the previous slide said October, so please remember September. That's next Wednesday. We'll have Dr. Amanda Brewster. She's a professor of health policy management at UC Berkeley, and she'll share her research that she's done with AAAs since I think back in 2013, which has shown that partnerships between AAAs and health plans reduces both healthcare use, Medicare spending, and it also decreases avoidable nursing home use. And then we will, to be determined, to be announced, the future date with a webinar with leadership from USA Aging, formerly the National Association of Area Agencies on Aging. So please join us for those. Keep a lookout. Again, posting links to this presentation, as well as the recording on our webpage at aging.ca.gov. And we'll also share it via our newsletter as well. So we'll let you know when those are all posted and ready for you to view. You can send any other questions you have to CDA. Our websites, our emails on our website. And apologies if we did not have a chance to get to your question, but thank you for joining us, and we hope to see you next week.